Most people think they understand weight loss. They don't. I'm Dr. BenMaamer, board certified general and vascular surgeon, and I see what happens when a metabolic disease is treated like a motivation problem. So, what are most people believe? Weight loss is about discipline. If diets fail, you didn't try hard enough. Surgery is extreme. Medication like Ozempic replace surgery. And that sounds logic until reality shows up. Because obesity is not simply excess weight, it's a chronic metabolic disease. Let me tell you what actually happens step by step. When someone diets, calories decrease, weight drops, the brain senses starvation, metabolism slows, hunger hormone like ghrelin rise, satiety signals weaken, the body defends, it fat stores. That's why long-term diet success rates are low. Now compare that to metabolic surgery. Procedures like sleeve gastrectomy, gastric bypass change, by definition, stomach volume, hormonal signaling, insulin sensitivity, gut-brain communication. This is not cosmetic, it's metabolic surgery. So what patients feel? Reduced appetite, earlier fullness, better blood sugar control. What doctors see? Sustained weight reduction, diabetes remission, reduced cardiovascular risk, improved blood pressure. So why it gets missed? Surgery is misunderstood because it's seen as a last resort, social stigma, insurance delays, fear of complication, online misinformation, and now GLP-1 medication. Medication like semaglutide are powerful. They work. But they require ongoing use. Weight often returns when stopped. Not every patient responds. Surgery and medication are not enemies. They are tools, sometimes complementary. And this is the part nobody likes to talk about it, the consequences. Untreated obesity increases risk of type 2 diabetes, coronary artery disease, stroke, peripheral artery disease, sleep apnea, early mortality. Long-term data consistently shows metabolic surgery reduces mortality. Very, very important. It improves cardiovascular outcomes. It lowers long-term disease burden. Yes, surgery has risks: bleeding, infection, nutritional deficiency, lifelong vitamin supplementation, need for structural follow-up. And yes, some weight regain can occur. Surgery is a tool, not magic, but the data shows durable metabolic benefit. So what you should do? You may be a candidate if BMI is more than 40, or BMI is more than 35 with comorbidity, poorly controlled diabetes, failed structural medication, weight loss. You may not be a candidate if BMI is less than 30 without disease, and stable psychiatric illness or poor follow-up potential. Those are questions to ask your doctor. Am I a metabolic surgery candidate? What are my long-term outcomes? What are the risks? How will follow-up work? Let me give you some red flags. Rapidly worsening diabetes, vascular complication, severe sleep apnea. This is not about appearance, it's about long-term survival and cardiovascular risk reduction. Again, I explain this not to scare you, but to make you act earlier, not later. Obesity is a medical condition. Medical conditions deserve medical solution. So I'm gonna give you my recommendation. Don't ignore metabolic disease. Don't blame yourself. Don't rely only on willpower. Seek qualified metabolic evaluation. And if you believe healthcare in America needs to change, hit follow. We are building a momentum one video at a time.